Medications for Respiratory Health, a presentation by the Breathewell Pulmonary Rehab Program at the Chatham-Kent Community Health Centers. In this video, we will review many different types of medications that are important to respiratory health when living with COPD. These include inhaled medications, oral medications, home oxygen, vaccines, and smoking cessation medications. Taking your medications daily as prescribed can help to relieve or lessen your COPD-related symptoms, including shortness of breath and cough. It is important to take these medications as directed. Some must be taken daily, while others are for as-needed use for immediate symptom relief. Some inhaled medications are long-acting, while others are meant to work quickly but for a shorter period of time. Always follow the prescription when taking any medication. Inhaled medications. These include bronchodilators and combination inhalers. Let's first take a look at bronchodilators. Inhaled bronchodilators work by relaxing the muscles of the airways. This class of medication will improve lung function and provide relief of symptoms, including shortness of breath and improving exercise endurance. Bronchodilators may be short-acting or long-acting. Salbutamol is a commonly prescribed short-acting bronchodilator. This inhaled medication works quickly to provide fast relief of shortness of breath or cough. It is usually taken as needed when symptoms arise. Sometimes this type of inhaler is called a reliever or rescue inhaler. It acts quickly, but the medication wears off after a shorter period of time compared to long-acting bronchodilators. Long-acting bronchodilators include salmeterol and tiotropium. This class of inhalers work for much longer periods of time. However, they do not act quickly to relieve immediate symptoms and therefore are not used as rescue inhalers. Other inhalers used to treat COPD contain a bronchodilator and another type of medication called a corticosteroid. Corticosteroids provide an anti-inflammatory effect. The combination effect helps to relax the muscles of the airways and treat airway inflammation or swelling. This class of medication improves rates of COPD flare-ups, lung function, and health status. A common side effect of inhaled medications containing corticosteroids is thrush, a fungal infection that can develop in the mouth or throat. It is very important to gargle with water and spit the water out after every administration of an inhaler containing corticosteroids to reduce the risk of thrush. Inhaled medications come in many different devices. Let's first take a look at MDIs, or meter-dose inhalers. An MDI is an inhaler with a canister of medication that is depressed to release an aerosol that is inhaled. When you first open a new MDI, you must prime the inhaler. To do this, shake the inhaler for 10 seconds. Remove the cap covering the mouthpiece. Pointing the mouthpiece away from yourself and others, push down on the canister to release a dose of medication. The MDI is now primed and ready for use. Medications delivered through an MDI require a slow, deep breath in to get the best delivery of medication. It is always recommended to use a spacing device with an MDI. A spacing device creates a longer pathway for the medication to travel from the MDI to your oral cavity, therefore reducing the speed at which it enters your mouth. It also allows more of the medication to be inhaled deeply into the lungs rather than hitting the back of the throat. Spacers require regular cleaning and maintenance to keep them in good working condition and reduce bacteria buildup. It's important to note that you should not float the MDI canister in water. This does not show if you still have medication left in the canister. Instead, use a calendar to keep track of how many puffs you have given yourself each day to figure out how many doses you should have remaining in the inhaler. Some MDIs even come with a dose counter on the device. Dry powder inhalers are another type of inhaled medication. These medications are delivered through the inhalation of a fine powder. As you can see from the photo, there are different types of dry powder inhaler devices. These inhalers do not require a spacing device to be used. This type of medication requires a quick inhalation to get the full dose of medication delivered to the lungs. It is important to always wipe the mouthpiece after use to avoid bacteria buildup. Soft mist inhalers, or SMIs, deliver medication through a fine mist that is expelled slower and stays in the air longer than an aerosol produced by an MDI. They are propellant-free and are fit with a dose counter on the device. When you first open a new SMI, you must prime the inhaler. To do this, hold the device upright with the cap closed and twist the clear base to the right until you hear a click. Open the cap, direct the device towards the floor and away from you, and press the button on the side of the device until a mist comes out. Repeat this 3 times. If you do not use your SMI for more than 3 days, prime the device again just once. Always wipe the mouthpiece after each use. Some individuals may have difficulty administering inhalers. In these cases, a nebulizer may be prescribed. A nebulizer is a machine that delivers medication through a fine mist through a mask that fits over your mouth and nose. It is important to follow proper care and cleaning instructions with the nebulizer. Each inhaler device has a specific technique for administration. Proper device technique is essential to making sure you are getting the most out of each inhalation. Inhaler technique should also be reviewed on a regular basis. For detailed videos on device technique, visit the Lung Association webpage for video tutorials at www.lung.ca. Not everyone with COPD will require oxygen. However, if the levels of oxygen in your blood are low, oxygen may be necessary. Using oxygen may help to improve your quality of life. It is a medication and therefore requires a prescription from a physician or nurse practitioner. In Ontario, some or all of your oxygen prescription may be covered if you meet eligibility criteria. To test if you qualify and could benefit from oxygen, you may complete a walk test to monitor your oxygen levels with exertion and/or complete an arterial blood gas, whereby blood is taken from the artery in your wrist and analyzed. Oxygen can be delivered through different devices, such as concentrators, portable concentrators, cylinders, or liquid oxygen. Not all medications used to treat and manage COPD symptoms are inhaled. Oral bronchodilators, such as theophylline, relieve shortness of breath by dilating the muscles that surround the bronchi of the lungs. In order to work properly, they must be taken regularly. Medication levels must be monitored closely with blood work to avoid toxicity, which can result in harmful outcomes that can be fatal. Roflumilast, or Daxis, is an oral anti-inflammatory medication that can help to stop narrowing of the airways that occurs with COPD. Antibiotics are a class of medications used to treat acute exacerbations of COPD or COPD flare-ups. Signs of a COPD flare-up include an increase in shortness of breath, an increase in cough, or changes in sputum production that last more than 48 hours. You may require additional medications, including antibiotics, to treat the COPD flare-up. The type of antibiotic prescribed will depend on many factors, including when your last COPD flare-up occurred and if you are on oxygen. When you start a new course of antibiotics, be sure to finish the prescription completely as directed. Oral glucocorticosteroids, including prednisone, are anti-inflammatory medications that are often used in combination with antibiotics to treat COPD flare-ups. These medications can cause many side effects for some individuals, including, but not limited to, increased appetite, mood swings, fluid retention, and increases in blood sugar. Long-term use of these medications can cause additional side effects, including, but not limited to, easy bruising, weight gain, increased lipids, and muscle weakness. If taking this medication for greater than 2 weeks, it should not be stopped suddenly, as it can cause withdrawal symptoms. You may be directed to wean down the dose over a period of time. Vaccines are an important part of maintaining your lung health. Vaccines protect against diseases by building an immune response to fight the pathogen if your body comes in contact with it. The influenza vaccine or flu shot is given once a year, typically in the fall. If you have COPD, you are at an increased risk for hospitalization due to influenza. The pneumonia shot is usually given once, and it may be repeated 10 years later. Your primary care provider can determine if this is appropriate for you. A history of cigarette smoking is a leading cause for COPD. If you or someone you know is currently smoking cigarettes and looking for help to quit smoking, there are medications that can help. Nicotine replacement therapy products help reduce nicotine withdrawal by providing low levels of nicotine into the bloodstream. These levels are much lower than a cigarette and are not accompanied with the hundreds of other chemicals found in cigarettes. Varenicline and bupropion work to reduce cravings and withdrawal symptoms while quitting smoking. Talk to your primary care provider or pharmacist about the different options available to you. Some of these medications may be covered by your drug plan. Quitting smoking is one of the very best things you can do for your lung health. Medication tips. Always keep your medications in a dry place. Avoid keeping them in the bathroom due to humidity exposure. To keep your inhaled medications clean, always wipe the mouthpiece after each use. If you are considering a new over-the-counter medication, supplement, or vitamin, talk to your pharmacist or primary care provider first to ensure these medications are safe and will not interact with your other medications. If you're thinking about stopping a medication, talk to your primary care provider or pharmacist first before doing so. If it's related to side effects, there may be ways that this can be addressed. Take your medications regularly. Use an alarm on your phone, pair medication taking with another daily task such as brushing your teeth, or use a calendar to help ensure you don't forget a dose. Medications for respiratory health are an important part of managing a chronic lung condition. If you have questions about any of your medications, talk to your primary care provider, pharmacist, or your certified respiratory educator. Review your device technique at each visit with your respiratory educator to ensure that you continue to take your medications properly. While medications are an important part of COPD management, remember there are many self-management tasks for living well with COPD, including eating well, exercising regularly, avoiding triggers, and monitoring your symptoms for changes. Thank you for viewing this presentation on medications for respiratory health. We hope it has been informative, and please reach out to our team if you have any questions.